Welcome to CareConnections Quick Tips. Once you have a patient in the system, they've taken their evaluation, and they've seen the clinician, you'll want to enter the rest of the patient information, including the diagnosis. So let's take a look at how we do that. First, you'll either double-click on the patient or right-click and select Edit Registration. This will take you to the payer information page where you can enter their payer information, their plan, and who's seeing the patient. You have the option to add a referring practitioner. If you would like to do this, I highly recommend it because there are reports that you can pull by referring practitioner. This is a really nice way for the folks doing marketing and physician visits to see who's referred the most patients and what types of patients they've referred. Then we click Next, and then we'll add in our diagnosis code. And the anatomic group, and the surgery type. Click Next. And here we'll see that all of the scores from their electronic assessment have been pre-populated. And then we're done. We can go ahead and save our changes. And you'll see that it will automatically pull up a document called a registration summary. This is a really handy tool for clinicians. There is a lot going on the form, but I'll point out just a couple of key things. First off is the functional MCID. That's minimally clinically important difference. This is the amount of functional change that you want to get on your assessment so that you know that your intervention is what's making the difference, not just random chance. So especially for newer clinicians, this is a great number to have them shoot for if they're just out of school. If you're a veteran clinician, you want to do better than that. Our veteran clinicians will look here at the national averages. So for this type of patient, risk adjusted, we expect them to get about 27 points of change over about 11 visits. And we're looking at about 2.5 points of pain change. So this is actually really great for having those initial discussions with the patient. Many patients have never been to physical therapy or don't really have appropriate expectations for what physical therapy is and their level of engagement. So I always like to point out this number of visits because it's a really great discussion point to have with the patient. It helps you coach them on how tissues take time to heal, strength takes time to build, how it's not a 1 or 2 visits and they're better. They don't take a pill, they don't get a massage. You're in a partnership together to improve their health overall, and that's going to take a little bit of time. So that's some really nice expectation setting. There is one other document that you can get. So if we go back over to our patient under treatment registrations and look them up, we can right-click again, and then we can go to Print Assessment History. And this will give you a snapshot of all the assessment questions that were asked of them and what their answers are. So both of these documents are nice to download as a PDF and upload into your EMR, or perhaps you use them for progress reports or just keeping track of the patient's progress over time. So those are a couple of different documents that you can get from that patient right from the start as soon as that diagnosis is in there. Remember, if you ever have any other questions, you can always email us at support@careconnections.com.